Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 5:30, and we try to highlight trending health issues from around the world. This week we are looking at how to reduce child mortality according to new findings by the United Nations Interagency Group for Global Child Estimation for child mortality. The annual death of children under age 5 reached a historical low in 2022. About 9 million under 5 deaths could be prevented by accelerating progress to meet the SDG target by 2030. This is our focus. Please stay tuned. The conversation begins after this break. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Olufemi Adeyemi, a public health physician and health specialist with UNICEF, and he is going to share his expertise and thoughts on the recently released report by the United Nations Interagency Group for Child Mortality Estimation 2022. Good evening, Dr. Adeyemi, and thanks for joining us.
Good evening. Thank you for having us.
All right, Dr. Adeyemi, tell us what exactly is the report by the United Nations Interagency Group for Child Mortality Estimation. Tell us about this report.
Yeah, the 2023 report actually is an estimate of the United Nations Interagency Group for Child Mortality Estimations. And the one for the summary for the one for 2023, which has just been released, is that the first thing is that we have made appreciable progress in the number of children that are dying before their 5th birthday. And this is actually a very good time for us to now look at what are the things that have led to this achievement, what do we need to reflect on, and how do we need to move forward to make sure that we save more lives. The annual death toll amongst children, adolescents, and youth remains, though there has been an improvement, but it's still unacceptably high. Because when we look at what the last one that we have, they're talking about approximately 4.9 million deaths in the last since in 2022. And when you look at 4.9 million deaths, what that means is that out of the 4.9 million, about 2.3 out of the 4.9 deaths that result from the first month of life, while 2.6 for children who are under the age of 5 years, meaning 1 month to 59 months. When we look at it, though, we say there has been a remarkable improvement, but when you look at the numbers, it can be a bit scary. From 2000 to 2022, the total number of deaths that we have had is about 221 million. That is talking about the whole population of Nigeria, which is not something that is very palatable to one's normal hearing. And one of the other things we observe is that children who endure so much of unequal chances for survival. What we talk about, particularly in UNICEF, is that for every child to be born, for the child to survive and the child to thrive and to become whatever God has in mind for that child to become. But then, when you look at inequity that we find all over the world, the socioeconomic group, and then all these conflicts affected settings, all this one tend to draw us back from what we want to achieve. And that means unless we do something very, very urgent to hasten and accelerate what we are doing, then the possibility of achieving the SDGs for 2030 might be a bit far-fetched, especially amongst the low and low medium income countries, which are mostly in sub-Saharan Africa, for which Nigeria is one of them. One other thing that we can know for here is that the progress, yes, the progress has been, this progress is actually possible, even in the low and low middle income countries. But a lot still needs to be done. There has been a lot of investment in local, subnational, national levels, and we need to continue to keep on ensuring that we put proven interventions to reach every community. With that, we can be sure we are likely to reduce the risk of newborn mortality and deaths amongst children. A key thing that is of paramount thing here also is that it is usually said anything that happens that is not reported has not really happened, So there are still issues with data, and we need to make sure that we have data that is available in the right places, especially those places with the highest risk, so that we can see how we're going. I think I'll pause for now, and then take more questions.
Okay, thank you so much, Doctor. It is satisfying that even the low and middle income countries made some progress according to the report, the 2023 report. But it is sad that one neonatal death occurred every 14 seconds and one under 5 deaths every 5 seconds. What could be attributed to this trend despite the commitment by key players?
Yes, when you look at it, yes, it is actually very scary. Like I had actually said earlier, when you're talking about 4.9 million deaths in 1 year, what are the things that we're doing? What are the things that we're not supposed to do? Now, one of the key things is that when you look at the very high intervention things that we put in place, like immunization, for example, when you see the coverage of immunization or uptake is still not where it's supposed to be. And then when we look at access to even healthcare, in this day, one of the key things that, for example, in Nigeria, we're talking about financing for now, and we need to talk about everyone needs to be on one form of health insurance or the other. So access to these high impact interventions are still very far from where they're supposed to be. And then when we look at the whole world too, we see how so many war-torn or conflict zones or conflict areas that actually fit these numbers. Yes, like I said earlier, there has been a decrease, but it's not when you see having about a neonatal death every 14 seconds, under 5 deaths every 5 seconds, and then the adolescent every 35 seconds all over the world. That means that we are still very far from where we are supposed to be. If you bring it down to real numbers, what that actually means is that 1 in 27 children died before their 5th birthday. 1 in 58 newborns died before, died. 1 in 50 children died between the ages of the first month and then the 59 months. That is the first 5 years, first five years of life. And the same thing, look at 1 in 61 children. When I'm talking about children, adolescents, and youth now, between the ages of 5 and 24, they still die. That is a bit scary. It's still very far from the benchmark that is stipulated by the SDGs. The same thing, it goes down to from 0 to 24 years of age. 1 in 19 children, adolescents, and youth between the ages of 0 and 24 still die. So that is something that is still worrisome. And what this means is that we need to keep on increasing on what we are doing to make sure that we get to a desired level where we can say there's some level of equity. We cannot really say we can have 100%, but let's get something as close to it. Thank you.
Okay, despite the achievements and the lows reported, about 59 countries are at risk of missing the SDG target in less than 6 years. 2020 is just around the corner. What should we be doing as countries, individual countries, because it is a global task? What should we be doing individually as a country?
Well, when we say we have issues, it is not just good to be talking about the issues we have, but it is better for us to actionate whatever things that we see to work or what has been proven to have worked. When you look at the 59 countries we are talking about, most of them are within the sub-Saharan Africa, and that is where we really have the issues. When you're talking about 59 countries that are at risk of missing the SDGs, that is where they are. And when you also look at it, that there are also still 64 countries who are at risk of missing the SDGs, the neonatal mortality target. They are still found essentially within the same zone. So what are we supposed to do? When we look at the current trend, if we're to continue the way we are now and say, look, let us rest now, what it means is that with our current trend, about 35 million children under 5 are projected to die about 6 years down the line. And that means if you add to that, you are talking about 16 million children, adolescent youth between the ages of 5 and 24 years are projected to also lose their lives by the age of 2030. You are talking about multiple countries, as it were, being wiped off, because we see how so many countries in the world that with a population of less than 5 million, and we see how those with population less than 16 million. So if the SDG targets were to be met by 2030, you can be rest assured that about 9 million under 5 deaths could have been prevented by accelerating the progress to meet the SDGs in all these countries that are at high risk. You did ask that what are the things that we need to keep on doing. Now, the way it is now, we need to move from our comfort zone. Emphasis now should be on local action. We need to take the planning down to the very grassroots. We need to take the monitoring, evaluation, and then that of political will to ensure that, look, we are not just saying this thing, we are not just talking the talk, but we are walking the talk. If we do that, we are likely to shift a little. We need to elevate the level of our investments, our ambitions for mothers and children. That means we need to do everything to ensure that we reduce neonatal mortality rates. And how do we do that? We're talking about having access to skilled back, for example. You remember that we had earlier said there was about 2.4, 2.6 now for neonatal deaths. So if we put more emphasis on skilled back attendance and early newborn care, as it's being projected and being talked about now when we talk about primary health care under one roof, where we're talking about having primary health care everywhere, and then making a primary health care a one-stop shop. And making it a one-stop shop also means that it must also be accessible financially. And that means that we should also be able to talk about having some financial buffer in form of health insurance for the very vulnerable and those who are identified to be in that kind of a care. That will move the process a bit forward. We need to scale up. We need to build up synergies along the continuum of care. From the time a baby is conceived in the womb, we must know that that baby that is conceived in the womb at one time has to be born. And when this baby is born, baby has to go through the rudiments of childhood, take vaccination, do this, proper nutrition, and what have you. And then eventually we go to an adult and all. So it's a continuum of care we're talking about. So there's serious need for us to strengthen our system to be able to uptake what we are talking about. And then, of course, also strengthen all the delivery platforms that we have. Of course, too, there's need for us to invest in community health workers, especially in this part of the world, especially in Nigeria now with this Japa syndrome. There's huge gap in human resources, but there's still that cluster of community workers that are not really being tapped or maximized. For us, for example, in Nigeria now, we talk about building these community health workers so that they can be the critical they can bridge the critical gap that we see today for care across the life course. Those, well, are not likely to Japa or the Japa syndrome to that fast because they are right there in the community. And when we now talk about community ownership, it makes the whole continuum a lot easier. Well, that means that from the moment a woman conceives, the community is very much aware. The community is interested in the outcome of that baby. Every person, once a woman is pregnant now, it's no more the responsibility of the immediate family or the husband alone. It becomes the responsibility of the whole community. So the chances of such a child coming out strong and surviving and then thriving to become what is ordained to have become is a lot better. And of course, we need to strengthen data and statistical systems.
All right.
We may say we want to do all these things.
Dr. Adeyemi has been analyzing the recently released United Nations Interagency Group for Child Mortality Estimation, and we are hoping that we'll bring him back on board to analyze fully the 96-page report because it was recently released. Thank you so much once again, Dr. Adeyemi.
Thank you very much and have a good evening.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. All right, the program is still Sound Health on Lagos Television. More to come in a moment. have been discussing how to reduce child mortality in Nigeria. Every life matters, no matter where a child lives or no matter where a child is born, regardless of status. Every life deserves to live. For comments or inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.